Loss after brain injury is really common, and the most difficult thing about it is that it's very individualised for people. It can affect people in different ways and it can affect people at different times. So the most important step and the first step is helping to validate that experience for someone and for them to understand the experience that they're having as well and how it's impacting their lives. So that's kind of the first step, and then you then would move on to thinking about what this loss means for you and why is this so significant to you, and how can we help you to navigate through this experience by thinking about who you are as a person and your values and what you can do to continue living a life in line with those values despite facing this really significant loss.
One of the ways in which sometimes people experience that is in terms of having a sort of a sense of loss of self, like the old self is kind of lost. And you can think of that almost in terms of like a grieving process. And I think that kind of language works for some people because they'll very much experience it in terms of a sense of loss or sort of partial loss. And the same can be said for family members as well, who are a really key part of this whole process. And the family members themselves will be seeing these significant changes to a loved one and trying to make sense of that. And there'll be aspects of the former life that are lost as well. So, and I think, within the realms of sort of psychological therapy and counselling, thinking about how to help someone to grieve and to move on can be really helpful.
I guess what I would want to impart would be a sense of understanding. What's happened to you is a big event. It's often a very traumatic event, and it often takes time for people to come to terms and maybe understand some of the challenges that are happening to them. So what I would want to impart is that understanding, and that there are people here that want to support and want to help and want to listen.